Hi, you guys. My name is Dr. Courtney Ray. If you are a subscriber to this channel, you already know that I am a clinical neuropsychologist. I am not an epidemiologist, so I just want to make that clear so that no one thinks that I am trying to pass myself off as one. However, I do have experience with PPE, working both in the lab and in the healthcare setting, in hospitals, working with patients. And also I know quite a bit about the psychology of human beings. That is my expertise. So again, not an epidemiologist, and nothing that I'm going to present in this video is going to be contradictory to any of the great advice and information that has been publicly disseminated by the World Health Organization or the Center for Disease Control or Dr. Fauci or the Surgeon General or any of the other many professionals in this field. And, just putting it out there that everything that I'm gonna say are things that have already been said. But I want to do this video because I know that there's a lot of information that has been spread, and sometimes what the truth is and what the facts are can be kind of murky because there's so much. So I just want to kind of cut through the fog, talk about what some of the recommendations have been, what that means for us, and make sure that the people who are watching this have a good understanding of what exactly is being said and why, okay? So first things first, what the coronavirus is. So coronaviruses are a class of different types of viruses. This is not the only coronavirus there is. In fact, we've had lots of experience with lots of other types. And coronaviruses are just named that way because of the shape of or the structure of the virus. And COVID-19 is caused by a specific type of coronavirus. So in this video, I might say COVID-19 or I might say coronavirus, but just recognize that there are lots of different types of coronaviruses. The one that we're dealing with specifically is the one associated with COVID-19. And if I say those things, either one that I am specifically talking about, the COVID-19 coronavirus. Okay, and so respiratory coronaviruses, we've had a lot of dealings with in the past. The scientific community has done lots of research with these, SARS, MERS, different ones that people are familiar with from news stories from before. And so the idea of how this gets transmitted, some of those ideas were taken from experiences with other types of coronaviruses and maybe comparing and contrasting. And originally it was thought that it was an aerosol transmitted coronavirus, which means that it dispersed into the air and people breathed it in and out, and that's how they got the disease. And we know that some coronaviruses, some respiratory coronaviruses are transmitted this way. And there have been studies and real life experiences where people have been in enclosed spaces. There was one incident that happened a few years ago where there was a plane that was on a tarmac, someone was sick, and even people who did not come in contact with that person also got sick, even if they were sitting rows and rows away, because they were sharing the same non-recirculated air. And so there were people who were a far distance from the individual who was sick, but who also got sick. And the vast majority of the people in that plane got sick. And so when those things happen, it kind of gives us an idea, okay, these things are spread in the air. Unlike other viruses like HIV, which has to have close intimate contact and exchange of body fluids, like semen, like blood, things like saliva don't have enough of a viral load to be able to transmit HIV. So HIV is a different type of virus, and it is not a respiratory virus, and it is definitely a different type of virus than the coronavirus that we're talking about, okay? So just so people understand that different viruses are transmitted in different ways. Now, even though it was originally said that it was aerosol, that was sort of walked back a little bit, where it was downgraded to droplet transmission. And I have some theories about why that public announcement was made, but that's not what this video is. Remember, I said that I'm not going to be sharing my personal opinions or anything like that about it, about the epidemiological component of it, because that is not my area. But suffice it to say, for whatever reason, it was publicly stated that this is transmitted through droplets. Droplets are things that, you know, come out of your mouth when you talk, or when you breathe hard, or when you cough or you sneeze. And if you've seen somebody who's disgusting enough to not cover their mouth when they sneeze, you probably have seen like all this like stuff just come out of their mouth, you know, saliva and lots of other kind of germs, right? And that's why you should cover your mouth and cough, even if we weren't in the middle of a pandemic. Just do it. It's just more hygienic. But those aren't the only ways that droplets can be transmitted. When you breathe hard, when you talk loudly, when you sing, those things disperse micro droplets, which can also contain the virus. And even though you can't see them, it doesn't mean that they're not being dispersed. Because of that, the idea that these things can go far and wide is why people have been recommended to practice social distancing of at least 6 feet, because the idea is we want to create enough distance so that if droplets were dispersed into the air, they might either fall to the ground if they're large droplets, or they will diffuse themselves enough that it won't be enough viral load that you would actually contract the disease, the virus. So that is the basis for why it was said that people need to socially distance themselves, which is still a recommendation. And also the reason why originally it was said that people really don't need, in the general public, to cover their faces with PPE, with masks. So PPE is personal protective equipment. And you may have heard a few days ago that now those recommendations, well, not recommendations, but it is now suggested. I don't know if it's necessarily accurate to say it's recommended, but it is suggested that people do cover their mouths in public. It's optional still. And originally there was hesitation in saying that because they wanted to reduce confusion about why and what PPE is worn for. And I still am very much aligned with the fact that people don't need to wear PPE if you are not someone who already has COVID-19. And here's the reason why. When people wear PPE, they have what's called this is a psychological thing now. They tend to do what we call become social. They become secure, and that security is a false sense of security. They believe that they are able to now do things and take more risks than they ordinarily would. They become a lot less mindful of what they're doing because now they're protected. And the truth of the matter is, and this is something that the CDC says and the WHO says, and everyone has said, the PPE, even if you're wearing a face covering or a face mask, that will not protect you from getting the coronavirus if you are not someone who already has the coronavirus. So it is not intended or designed for you to prevent you from getting it. It's not a protective factor. But if people wear it, sometimes people have a tendency to believe that it is. And like I said, they stop doing the things like social distancing, and they stop being diligent about being in contact with people and things like that. And I see this. I see this all the time. You probably have seen it too. Gloves are another type of PPE. And I see people wearing gloves and they do all sorts of things where they are cross-contaminating. They pick up their credit card and they pick up cash and they pick up their keys and they turn doorknobs and they do all this other kind of stuff. And then they touch their clothes, they touch their car, they touch their phone. They still continue to cross-contaminate all of these different surfaces with their gloves on. At the very, very beginning of this, when I was still seeing patients, just the general public in my office for different assessments, and people would come in and they would wear masks sometimes and they would wear gloves, I would tell people, the patients who I was seeing, I need you to take off your gloves before we get started with the assessment. Why? Because my assessments require people to do different manipulatives where you are touching the materials that I use for testing. And so when you have your gloves that you've touched the elevator button and the door handle and whatever else you may have been touching, and then you touch my instruments, now those things are now contaminated with the germs of whatever you have brought from the outside. So what I would do is I would tell my patients, take off your gloves. Then I would give them hand sanitizer to clean their hands. Now that their hands are clean, they can use the manipulatives. After the assessment was over, then they were given some more hand sanitizer. So now they could clean their hands again and they could go. That way, they have their hands clean before they touch my clean manipulatives. And if for some reason they felt like, oh, I don't know if your manipulatives are clean or not, that's totally fine, because now you also are using the antibacterial solution to clean your hands again. And so now your hands are clean again, okay? And people don't do that if they have on gloves. If they have on gloves, they're touching everything and transferring the germs from one thing to another thing because they have this false sense of security. And that's a natural human instinct because people aren't used to wearing PPE. And I remember, like I said, I have experience wearing this for the lab and wearing this in the hospital, seeing patients and things like that. And when I first started, I definitely it didn't click on how much I needed to be diligent, even though I'm wearing gloves. And so I remember one time my supervisor straight up said, even as much as you think that the gloves are there to protect your hands, they are also there to protect the things that you are touching from cross-contamination. You're also protecting those things from getting contaminated with whatever else you're touching. So it's not just about protecting your hands, but also protecting cross-contamination of all these other things. And that is not something that people are used to doing. And like I said, that false sense of security makes people much more prone to just disregard the things that they should do. If you're not wearing gloves, then you're a lot more conscious of the fact that, oh, I need to wash my hands. I need to make sure my hands are clean. I just touched this thing. Let me clean my hands. Let me use hand sanitizer, all that kind of stuff. And the same thing happens with masks. Like I said, patients would come in, they'd have on their gloves, they'd have on their masks. And most of the time, the masks were not fitted masks. They weren't properly secured masks. They had just some mask or something that they put over themselves, but then they would touch it. They would touch their face, they would adjust it, they would just be touching and introducing germs onto their face that they're trying to prevent themselves from getting. And so it totally defeated the purpose because they are now exposing themselves to the very same thing that they're trying to not get. And also, like I said, people have a tendency that, oh, I'm wearing a face covering, I'm wearing a mask, so now it should be fine for me to go and spend time with somebody else or go out and be in a crowded place or something like that. And those aren't the things that you need to do. So you might be saying, okay, if that's the case, then why were we just told that the public should wear face coverings? Why was it suggested that people make their own face coverings from a bandana or whatever the case may be? All right, bandanas and cloths and things like that are not the type of PPE that filters out the small microns of viral particles. So if you are in a place that has a whole bunch of particles just floating around, and you have your bandana and you're like, oh yeah, I'm gonna be able to do this and I'm not gonna get sick, you are still vulnerable, because that isn't going to filter anything. It has to be a medical grade mask, specifically N95 or higher, so that you can filter out those particles. So then why are people being asked to cover themselves? It is not to prevent you from getting the virus. It is to prevent you, if you have the virus, from spreading it to other people. Because one thing that we do know is that a lot of the transmission of this virus has been from people who are asymptomatic. So that means someone who doesn't seem sick. They don't have any signs or any other things that show that they have the illness. They don't have a fever. They don't have chills. They don't have a sore throat. There's nothing about them that would make you believe that they have the virus. And so they're feeling fine and walking along, and they are unwittingly passing it to someone else. And they're breathing hard, or they're talking loudly, or they're singing, or they're doing something that passes it from them to somebody else. And the next person that they give it to may or may not have any signs themselves. They also might be asymptomatic. And so they are inhaling those particles, they're going out, they're talking, doing all these other kinds of things, touching their face and then touching other things that someone else is touching, and they are spreading it along. And it could pass through several people without any of them getting the classic signs of sickness, but then it gets to someone who does get sick, someone who does show signs and symptoms, and who does get a fever, and who does have shortness of breath, and who does wind up having to go to the hospital and be put on a ventilator. And so the idea is that if you have a face covering on, then you are preventing the spread if you have the virus, even if you don't think that you have it. And that can kind of hopefully catch some of those macro particles and those droplets that you might be expelling from your own mouth will be stopped or trapped in the fabric before they are dispersed widely. Or, it's not a perfect solution, but the idea is that it at least slows the transmission and decreases the likelihood that as you're talking or breathing or whatever, that those particles won't be as diffuse as if you don't have a covering. So I want people to really, really, really understand that the masks are not suggested so that you, as a person who does not have the virus, can now feel free to go and do whatever and disregard social distancing rules. That is not what that's about. This is not intended to protect someone who does not have the virus from getting the virus from someone else. It is not going to protect you that way because it is not a medical grade mask. It does not have the same filtration properties as the masks that are recommended to be used to stop transmission. It is, however, important for people to wear the mask or wear some kind of face covering, whether that's a scarf or something else, to try to hopefully slow the spread of them sharing the virus with someone else, even if they don't recognize that they have the virus. So I think that that is an important distinction for people to make, for people to understand. And like I said, it is a recommendation for people to wear the face coverings so that we can hopefully slow this transmission. But I want people to really, really understand that this is not a protective factor for you to keep you from getting sick. Okay. And, everything that I said, like I said, is not new information or some kind of revelation that I have or based on my own research. These are all things that have been said by epidemiologists, by the agencies that are taking the lead on trying to slow this thing down. And you don't have to take my word for it. Just like LeVar Burton used to say on Reading Rainbow, you don't have to take my word for it. And in fact, I encourage you not to just take my word for it. I want you and I want people to get into the habit of going out and looking at sources, reliable sources, firsthand sources, primary sources, and looking to make sure that the things that they're hearing on YouTube videos or reading on Facebook or Instagram or Twitter or whatever the case may be, that these things are legit. You can't just rely on these memes. And I hate these memes where people say, oh yeah, this was sent to me by a nursing friend who's anonymous, who is saying all kinds of nonsense. I saw someone post something about eating alkaline fruits and vegetables will kill the virus. And there were so many things wrong with that post. It was unbelievable because it had things that are acidic, first of all, listed as being alkaline. And then it had numbers for the alkaline foods that were totally off the charts because the pH balances are only from 1 to 14. You can't have anything more than that. And the idea that people think that, oh yeah, I could just eat this fruit and I'll be cured. If that was the case, we wouldn't have people dying by the thousands, you guys. So really and truly, please evaluate and please research and please don't just take whatever you see on a post or something that was told to you and think that, oh yes, this is the truth. Make sure that you are cross-checking it, cross-referencing it, use your critical thinking skills, and above all, be safe.